You're probably familiar with the benzodiazepines diazepam, Valium, lorazepam, Ativan, and alprazolam, Xanax. They're among the most popular drugs worldwide, prescribed most often for generalized anxiety and panic attacks. Xanax has become the fourth most widely prescribed drug in the United States, and it's no surprise. In a nation where anxiety is as prevalent as the common cold, these medications do their job. But there is a dark side, many dark sides, that should make you think twice before hopping on the benzo bandwagon. These drugs can be used safely, but the decision to take them shouldn't be entered into lightly. How do benzodiazepines work? Benzodiazepines stimulate the brain's receptors for a chemical called gamma-aminobutyric acid, GABA, the major inhibitory neurotransmitter impacting anxiety, mood, sleep, and pain sensitivity. The various benzodiazepines differ primarily in how fast and how long they act. What are the side effects? They can decrease your ability to think clearly, impair memory, and reduce your ability to respond to emergency situations that may arise. For example, if you are driving a car or operating a dangerous piece of machinery. Read more. What you need to know about Enterovirus D68. These effects can be seen even in the lowest doses that are usually prescribed. In addition, a recent study found that the use of one of these drugs for at least 3 months increases your risk of Alzheimer's disease by 50%. In high doses, benzodiazepines can cause life-threatening respiratory suppression or result in a coma. Since 2000, the number of emergency room visits due to benzo use has doubled. When combined with narcotics, the risk and severity of these side effects is significantly increased. Are these drugs habit-forming? Yes. Their continued use downregulates the brain's sensitivity to GABA, so not only will you need more of the drug to get the same benefit over time, your baseline state of anxiety without the drug actually increases. It can be very difficult to get off benzos once you've started them, and stopping can come with serious withdrawal symptoms. Insomnia, irritability, heightened anxiety, panic, and restlessness are among the most common symptoms. More patients now end up in detox for the combined use of benzodiazepines and opioids than for all alcohol-related complications. Can you use these drugs safely? Are there alternatives? Benzos can be effective in relieving an acute panic attack or preventing one in a high-risk situation. However, there are almost always better alternatives. Selective serotonin reuptake inhibitors, SSRIs, like sertraline, Zoloft, and escitalopram, Lexapro, and selective norepinephrine reuptake inhibitors, SNRIs, like venlafaxine, Effexor, and duloxetine, Cymbalta, are the first choice in managing generalized chronic anxiety in those patients who require medication. Want more content like this? Sign up for the LiveIsStrong.com newsletter. In the long run, getting to the root of the problem through cognitive behavioral therapy, CBT, counseling and modifying your lifestyle to fortify your defenses against anxiety, getting proper sleep, optimizing nutrition and avoiding caffeine and alcohol can have a cumulative effect that can lessen or even eliminate your need for these drugs. Applying skills learned in CBT or using deep breathing exercises or visualizations. There are many mobile apps that make this convenient, can abort many panic attacks before they become unmanageable. And the more you practice and use these skills, the more effective they become. Readers, have you ever taken anti-anxiety drugs? Did you suffer from the side effects mentioned above? Have you tried any of the alternatives, such as cognitive behavioral therapy, CBT? Did you find it more or less helpful than taking benzos? Leave a comment below and let us know. Dr. Malcolm Thaler is a physician at One Medical Group. He enjoys being on the front lines of patient care, managing diagnostic and therapeutic challenges with a compassionate, integrative approach that stresses close doctor-patient collaboration. He is the author and chief editor of several best-selling medical textbooks and online resources, and has extensive expertise in managing a wide range of issues, including the prevention and treatment of cardiovascular disease, diabetes, and sports injuries. Dr. Thaler graduated magna cum laude from Amherst College, earned his MD from Duke University, and completed his residency in internal medicine at Harvard's New England Deaconess Hospital and Temple University Hospital. He joined One Medical from his national award-winning internal medicine practice in Pennsylvania and was an attending physician at the Bryn Mawr Hospital since 1986. He is certified through the American Board of Internal Medicine. As a psychiatrist with an integrative focus, Dr. Ellen Borer believes mental well-being is powerfully influenced by sleep, exercise, thought patterns, relationships, nutrition, spirituality, and creative outlets. She incorporates a variety of modalities into her psychiatry practice, including acupuncture, yoga philosophy, and breathing and relaxation techniques in conjunction with conventional treatments such as cognitive behavioral therapy, psychotherapy, and psychopharmacology. Dr. Borer believes mental health is fundamental to primary care and treats a range of health issues, from panic disorders to bipolar illness and ADHD to fibromyalgia. Dr. Borer graduated from Yale University and earned her MD at Columbia University. She completed a residency in psychiatry at Mount Sinai Hospital. She is a member of the American Psychiatric Association and the American Academy of Medical Acupuncture, and is a board-certified psychiatrist, licensed medical acupuncturist, and certified yoga instructor.